Make sure you're happy. John, put it into slideshow and just go through it. If you want to.
Asked a question. And it's the next person. So there are two of the. There'll be an opportunity for everybody to ask questions and online questions to come from Florian. If there's anybody watching the streaming still on a Saturday, we live in hope, you know, on a rainy Saturday. So.
Yeah, you just turn that on. I'll get up there now in 2 seconds.
And you've got your and you've got your screen down there as well. That's okay, and everyone can see that. So
I don't. You don't know experience. No, there's no mistakes in this life. Only learning opportunities.
we're full of cheesy lines. Right. Let us know if you need anything.
Hello, everybody. Good afternoon. Welcome back to the plenary session. I can hear by the buzz in the room, everybody's really enthused and energized by what's been going on this morning and yesterday, so I'm really pleased about that. A couple of housekeeping things, just to remind you that we are streaming this session live, so if you don't want to be in the stream, please, the far two tables at the back, you'll be out of the picture. So thank you very much for that. If we want to move right now. Let me remind you that this is going to be a voting session, so please make sure you've got your green, orange and white cards at the ready. We're going to do something similar to yesterday. I have beside me on the platform the workshop leaders from this morning, Neil, Anne, Gronya, and Ingrid, and they'll be presenting statements to you, and you'll be asked to vote on them as you did yes. I think the first person I'd like to ask is Neil. Would you like to come forward and start yours? I'll put your card up for you. You've been doing patient choice. Neil's very well known to everybody I know. He's with the EULAR Public Affairs as liaison officer, but he's also been long attached to PARE. Thank you, Neil.
Very attached, yeah. More ways than one. Hello, everybody. So, at the concept of patient choice, we separated the issues into two main categories. Firstly, there is what is available in your country, what services, what equipment, what benefits, what therapies are potentially there for people with RMDs where you live. And then secondly, just as importantly, how easy or difficult is it for people with RMDs in your country to access those services and that support? So we divided the session in this way. In one sense, the campaigning part is where you try to change the system to encourage policymakers and health policymakers in particular to offer more things, more support for people with RMDs, but also to empower patients to know what exists and then be strong in accessing those services. So that was the sort of the concept. We had some very creative thoughts here, and what I was particularly surprised by was when we looked at the barriers to people with RMDs getting what they want, getting what they need. I expected before that we would be speaking about finance, about which treatments are available, about patient information. All of those things are important, and they all were mentioned. But the main focus of both groups was on the psychology of the individual, the successful, is in the right mental space. It can get you down, can't it? It can lead to depression. Or you may be young, newly diagnosed, you may feel angry with the world, you don't really want to listen to what the system tells you. So there were lots of creative ideas to tackling these problems, such as developing more peer support, where younger people can find each other and support each other, and lots of ways in which we can try to raise the profile of this generally. So they were the concepts. Then we came up with 4 statements. Sorry, it's 4, maybe we cheated. But one of them's very short. And these are the things where we'd like you to vote. So, the first one, society, so the general public, society really loves causes which help children and young people. But we don't, as a community, an RMD community, we don't really always promote that. So, our statement, for you to agree or disagree, is we need to be more ruthless. We need to exploit, not the kids, but we need to exploit the appetite that society has to be interested in causes which help children. And if we can use children's experiences more in our work, in our visuals, our graphics, then we are more likely to attract support from the general public. So the statement is, society loves causes which help children. We need to be more ruthless in using kids' experiences to attract support. Are we doing the voting one by one, Di?
Yes,
Is that how it works?
One, please, because
So please, there you go.
Ah.
Ooh,
Ooh,
controversial. Oh, I love it.
mixed result. Just keep holding your cards up because somebody would be counting. Thank you.
Do we get the verdict, or?
The majority is agree.
The majority is green.
Yes, so the majority agree, but then there is quite a high proportion of those that didn't, and quite a few don't know.
Okay. So maybe this is a topic for further debate then, okay? So kids in Ireland, look out. We'll be coming to grab you and get your photograph taken soon. Okay, the second one, PARE's members, so that's you, PARE's members' success over many years in promoting the empowered patient model has actually turned non-assertive patients into victims. We spoke a lot in the group about those patients who don't feel they can be assertive. Maybe they're losing out compared with the expert patients who know exactly now that they have rights and they know how to articulate and speak about their rights. So we've been very successful in promoting self-management, shared decision-making, etc. But the losers there are those people who don't want to be like that. They want just to be told what to do. Shall we have a vote?
Another controversial statement. Yes.
Let's have a heated debate.
Now's
Okay.
the chance to vote. Oh, lots of orange.
Always goes orange, you know that. It's something to do with the country, I think.
That looks like disagree.
Okay. So I drew a drum roll before the verdict.
Mostly you disagree. So a few agree, but mostly it's disagree with that one.
Okay. Or maybe some people were too shy to... No, that would be... Sorry. Serious issues. Because some people need more time to get the confidence to vote. Yeah, okay. Right. So, two more. The range of complex new therapies, so mainly we're talking about the biologics, biosimilars, but could be more general. The range of complex new therapies available makes choosing the right one increasingly difficult. The science, the immunology, the molecule, it's so complicated. How can we possibly choose the right therapy?
Vote now.
That one, but I would say the majority is the disagrees, but very closely followed by agrees. So a lot of split votes there, a lot of different opinions. Oh, and there are some cards still held up for people who have very strong opinions.
As they used to say in these parts, vote early and vote often. But I won't go there. And finally, having an RMD makes you stronger.
Well, I think that's mostly agree, but again, there are a few people who disagree, and some people aren't quite sure, but I think mainly agree.
Okay. Thank you very much for your cooperation.
Thank you, Neil. Thank you, well done. Next, I'd like to invite Anne Stiglbelt to the stand, if you wouldn't mind. She's a professor of medical decision-making at Leiden University Medical Center, and her research and teaching relate to shared decision-making and risk communication, as well as quality of life and outcome preference assessment. Thank you, Anne.
Definition of have I not cover what the field thinks it is in general. Clinicians and patients make decisions together using the best available evidence. In partnership with their clinician, patients are encouraged to consider available options and the likely benefits and harms of each, to communicate their preferences and help select the course of action that best fits these. We had two very different workshops. I think it was really interesting to see the differences between the countries where there's more awareness than the countries where there's hardly any awareness at all. And to start with the latter, I think these countries where some people, well, doctors clearly are not aware, are aware. It's mostly culture and tradition. The doctors knows best, and that's the way it goes, and there's a big power imbalance. And only if you're, for example, a lawyer or a doctor or someone highly educated, you might have a say in the conversation. So the solution there mainly is to work on creating awareness of shared decision-making, of the concepts, and of patients' rights here. Solutions for patients were also quite basic. For example, passports or booklets, diaries for patients to empower them in a consultation. And the major one is the 3 questions campaign that's been rolled out in some countries, where people 3 basic what are my options, what are the benefits and harms of these options, and what is important to me. And for doctors, the concept of shared decision making and training in basic communication skills. Whereas if we go to the more advanced, I call it advanced, just basic and advanced, the countries where it's more, there's more awareness, still there is very little implementation. The consensus in the group was it's hardly being seen. And also communication is very disease-centered. Even if doctors think about goals, it's goals, remission in terms, for example, of clinical parameters and not remission in terms of quality of life. So implementation lacks here, and we need to work both on the side of the patient, on the side of the clinician, and on the organizational side, because big barriers there lie in time constraint, incentives, seeing all these different doctors all the time, so not being able to build a rapport with a doctor, care paths. And solutions for these countries where there's already more awareness lie more in tools for patients, patient education, websites, things like that. Training of doctors is not just communication skills training, but also training in shared decision making itself, and particularly showing doctors the benefits of shared decision making, because it has many benefits that doctors are not aware of, so they see it mostly as just time consuming. And an important conclusion from both workshops was that we should not do it separately, patients and doctors. It should be in collaboration, because you can have a campaign with the 3 questions, but if the doctors are unaware of this campaign and all of a sudden there's all these patients asking the questions, it may backfire. And similarly, if patients come with booklets and question prompt lists with all these questions, it might backfire if the doctor doesn't agree. So we really work together, patients and rheumatologists, other doctors, health professionals, sorry, to get this going. Now I can vote?
Will you give us your statement?
Yes, that's what I meant. The first one, it's up to patients to make shared decision-making happen. And it held strongly for the countries where there was not much awareness. Haha, this is a nice controversial one. We aimed for that. Not many whites. Esme, what's the verdict?
The verdict is that most of you disagree with that. So a few agree, but most of you disagree.
And the second one, we only had 2. There are many tools to support shared decision making, but they should be better implemented. Sorry about the misspelling. That was far too easy, I see.
Well, that's pretty well unanimous. You agree with that very strongly.
Okay, thank you very much.
Thank you, Han. Now next we have Gronje, who is the head of the service development in Arthritis Ireland. And she's also a Stanford University accredited master trainer in the Chronic Disease and Arthritis Self-Management Program. Thank you, Gronje.
Hey, hi everyone. So our workshop, we posed the question, what steps can organisations take to help people with RMD self-manage? And really the workshop focused on, looking at, I suppose, the evidence and our experience in Arthritis Ireland, offering the community-based Stanford model, which I know many of you in the room are familiar with. We've offered this 6-week self-management program in the community over the last 9 years to over 4,000 people through about 230 courses around in that 9 years in different around Ireland of delivery. So there's lots of positives in terms of the outcomes for people living with RMDs, improvements, better engagement in physical activity, better engagement in their own medical care, reduced healthcare utilisation. The list goes on, and for us as an organisation it was hugely beneficial in terms of building our volunteer network, and people who have become highly engaged and motivated to make to make changes and to help make a difference to other people, RMDs in Ireland. But I also highlighted some of the cons of this kind of a program. So obviously one of the cons would be sort of that we're limited in terms of numbers of people we can reach in a particular class. We're limited in terms of, we obviously have a budget. It's costly. It's a costly intervention. There's ongoing costs in terms of venue costs, materials, leader support, administration in terms of resources from our own organisation, in terms of our own office. So there are costs involved. In terms of the reach as well, people are not always, I suppose, not everybody wants to come to a class. It's also proven less attractive to younger people. So there's just some of the cons. While there's a huge amount of positives, there are some cons to this community programme. So we in Arthritis Ireland have, over the last 14 months, developed an online self-management intervention, and really I showcased this at the 2 workshops that have taken place this morning. And the online self-management programme is really taking some of the learnings from our community-based programme and augmenting in terms of areas we felt we didn't adequately cover or educate people on in our own organisation. So we have a huge component of this programme on self-management tools and self-management skills, and we showcase and encourage people to engage with those tools. But we also have a fairly sizable section on disease education itself. So that was a gap we felt we had in our service offering in Arthritis Ireland. And we also have another module on medications and medication management, because just to echo one of the statements there, it is an increasingly complex environment for lots of people in regards to medications, and people were requesting and asking for more information on medications. So we showcased that programme, and then we looked at some of the challenges to delivering this program in your own countries. What are the challenges? There's a lot of advantages, but what are the challenges? And we broke into small groups. I suppose the 3 key areas that we dealt with were things around resource issues. So obviously there is a cost to developing this type of program, so there's funding required, but there's also a resource requirement in terms of human resources, so the expertise to develop it both in-house within your own organisations, but also externally in terms of garnering the support of an entity that is an expert in sort of e-learning and has worked really in a healthcare field as well is important. We also looked at sort of the interaction and engagement and how that can be harnessed online as well, and that was, I think there was a lot of really good conversation around, well, if everything takes place online, there's perhaps less sharing of experiences, less engagement with people. If people have questions, how do you manage that? So there was very healthy discussion on that, and certainly lots of ideas for us to look at when we're reviewing what is our kind of first draft of the programme at the moment. We still have some changes to make. And we also looked at technical considerations. So we looked at, obviously the fact that this is a different type of programme. It needs a particular platform developed, but also there's requirements in terms of looking at your own home countries in terms of broadband access, computer literacy, computer access, all of those issues. So again, we had lots of interesting conversations about how those barriers and challenges might be overcome in encouraging people to access that programme. So that's really what took place at the workshop. In terms of just our statements that we would like to propose to you, the first one is that online self-management programmes are the way of the future. So if you wouldn't mind raising your card.
Vote now. Thank you.
I think that's a majority of agrees, but there are 1 or 2 disagrees. So again, a little bit of controversial there,
debate.
but mainly agree.
Okay. And then our second statement is that every person diagnosed with an RMD should be offered some form of self-management training. So,
Not surprisingly, you all agree.
less controversial.
Yes. Yes.
Okay, thank you very much.
Thank you, Grania. I'd now like to invite Ingrid Poldemar to the stand, please. Many of you in the room know Ingrid as one of the founders of the EULAR Young PARE group, and she's also a former PARE board member. Thank you, Ingrid.
Thank you, Diane. So, I had a pleasure to lead the youth workshop number 2. So, already for last few years, we have had youth workshops, and this workshop was also to look at official, like we have a strategy, and also we have the strategic objectives, but also tactical. That means actually action plan, what we are going to do, what the youth group is going to do in the next years, this year and 2016 as well. So one of the things was also to build up the network, but network consists of people, the leaders, and leaders are all human beings, and for that to be a good network, we need really strong leaders and confident leaders, and that actually it came out on the workshop that one part of the what came out in all our subgroup discussions that we have so many leaders in our room, but many of us just missed the last kick, that to find ourselves, find the leader inside us. So, and the leadership training could be one part to empower, and new leaders will soon be here with us. So, and also together with that, we wanted to support the national organizations, and one way to introduce the funding possibilities as one of the action plan aims. So, and Erasmus Plus youth program is one of them. And we have been using in the little bit about the history, how we have used it in the previous EULAR organization, and also youth work. And we also had a very great case study from Estonia that Epp Adler gave us. This was a really practical examples how this program could be used to support the youth work. Either this could be a youth exchange, either could be job shadowing or European voluntary service. But this good thing is also the program is for young people age 13 to 30, but it's also for the youth leaders and youth workers, and there is age limit 18 plus that organization, but really to build up the youth group or youth work. And from my experience, we used it, not used, but we found out that the best way to support national organization or national work, we needed to have some good candy for the young people, so they could participate in a great youth exchanges where it was educational, but not the formal, but informal. That means that we learned a lot of things through games, simulation games, through discussions, and actually taking part and trying things. So that if you practice and you see how it's done, you will learn as well. So it has been a really great tool to use. And in our workshop, we also gave an overview of the new program, how to apply, and also the tips how to do it. So inclusion is one of the main topics also for this program. So to include also people who have physical needs, and this program actually has a good supporting system, so there are no limits that if you think how to participate. And actually what came out also that we have to find the self-confidence to start it and actually maybe use more what we have done. The projects are never the same, but if there is a good planning already, like Let's Act Now, what we had, many of you have heard, it could be used in other countries as well, and to build up the networks. And it's all about the personal training. If you, as a leader, are empowered and you know what to do, how to do, or are confident and you want to try, all the magic will happen. So this just start small. You don't have to apply yourself immediately. It seems very like a difficult program, but it's like how to learn to ride a bike. So you have to learn and learn, but then you know. So get to know the program, and it will be great help for you. And and I hope in the coming years we will have great initiatives. And as they say, to empower young people, we were discussing empowered people. This is the outcome, already a result of the workshop. And I think with our workshop, you could see from the eyes that many of the participants were empowered after the workshop. So, and also to talk how further that what are the roles and what kind of statements. So we have actually 2 statements. The first one for you: developing international youth work and using European Union Erasmus Plus program is an underused possibility to empower national EULAR PARE members. So please show, how do you think? Do you agree or disagree?
Oh.
Wow. See?
Agree.
Agree.
Just simple, agree.
Thank you. And the second one, there is a need in EULAR PARE network to increase the knowledge and skills of their national members about the availability of different funding opportunities. Wow.
Well, another agree.
Yeah.
So that's
Thank
great.
you.
Thank you.
Thank you so much.
Thank you, Ingrid. Well, we've had an interesting selection of statements there, some of them more controversial than others. So no doubt there's mind. The questions are open to the floor now. Who would you like to speak to? Somebody must have a question. Yeah. Well, I've got one to start you off. Empowerment. It was voted against that empowering marginal. I wonder if that's actually true. Because do we have a group of people who we're not reaching? Are there minority groups, geographically isolated groups who really aren't in this empowered group?
From my point of view, I think they're probably the majority. Actually, if you take into account the different personality types, the different social, as you say, economic factors that might inhibit someone's ability to be this vision we all have of the super patient who understands their condition, understands their options, and is able to, feels confident enough to have a peer-to-peer discussion with their doctor and nurse. We are so familiar with that model because we've all been working towards it. Sometimes we all probably forget that the person driving the bus or cleaning the streets may have an RMD and not know any of that even exists. So I think we do have a duty to make extra efforts to reach out to cohorts, to groups that might not, easily find the great support that these patient groups can offer. And I guess the last point for me on that is that, technology is more of a friend than a foe there. As more and more people, have mobile smartphones, using apps and so on. Maybe there are new ways we can make the good stuff we have easier to find.
Anne?
Maybe I can comment on that too. Particularly, I totally agree that we have far less empowerment than we may want, and that's why I think if I'd voted, I would have voted against, because the victimization is not an issue, because it's still such a small minority, I think. Only when maybe 95% or something would be empowered, there might be the 5% victims. But even then, in my field, in shared decision making, I feel that if there's a group that gets more and more empowered by that group, the doctors will have to change their communication styles, and the small group, instead of being victimized.
Yes. Grania, do you want to, maybe your online course might there, do you think?
Well, I think in terms of reaching people who, I think perhaps I can certainly speak for my organisation, and I'm sure it might be a view shared in the room, you know, it is easy to reach people who want to be reached,
yes.
you know, and they're people that come to us, they you know, they self-refer into programs, they access the services, you know, the people who maybe stand back from all of that. But we need people who, you know, very low confidence manage their
yes.
condition, to interact with their physician. They're the people. But if we do succeed in getting them, we're likely to see huge changes. You know, really big change with individuals like that. If you can just hook them in.
If you just get at them.
And just to add to that, it's a curiosity on my part with the way the phrasing of the question that we voted on was that is that group marginalised because we are empowered? I don't, and that's where I was disagreeing in saying that it's not because we're empowered that it's the difficult to reach, as everyone has said. There's people that are hard to reach. It's not because we're empowered or there's empowered people that they're marginalised or not getting the information. It's because they're harder to reach. So it was kind of just the phraseology of the question I thought was, that was...
Yes, that's a good point. It's a fun game, in fact.
Yes. I wonder who is the magician that got some money from Euronymous in the EU commissioner. If you can tell us the secret, it will be really useful. Ingrid.
Sorry, you mean the EU Erasmus program? Yes.
Could you repeat the question? I didn't get the first part.
I would like to know who is the magician that got some money from the EU commissioner, health commissioner, via the Euronymous,
It's an EU
or it's
program.
only a support? No financial support, but what?
I think the question refers to the funding of the Erasmus.
And they will make decisions in the national level how to support these organizations, how to support the project. So you will apply to the national organization. Yes.
Thank you.
But there are also, it depends on what level, there are also European projects, but these are very big ones. And the main thing, what we focused were on the national level. So there is a great support system existing, and there are offices in every country also. So you have to look for the office what you have in your country.
Thank you, Ingrid. Any other question? In which case, I'm going to turn to Florian. Do we have any questions or comments from the Twitter wall, please?
Thank you, Di. I think we have loads of comments on the Twitter wall. I've just been summarizing a few of them, but I hope I won't take anything away from you in terms of summary of the whole conference, because what we've seen was a great coverage throughout the 2 days of all the sessions and all the workshops, but especially also the feedback sessions. And for example, catchy statements have been really reviewed a lot, like Claire's to put arthritis in the back seat and rather than having it as an interfering front seat driver. Or Ebb's statement on leading people and managing things. There aren't any questions as such because you have, I think, answered all of them. And if you want me to, I can give you another bit of an evaluation, but we will do that especially after the conference as well.
Thank you very much. It seems it's been a very great success having the Twitter wall, and I hope we're going to be able to continue that next year. So would you now join me thanking the panel very much for doing all the hard work, producing all these very controversial statements, and giving us all something to think about. Thanks very much.
So I agree with that. We have a lot of workshops, a lot of presentations, case studies. So we have opportunities for the networking, for exchange, knowledge between us and experience, best practice. So I am say the truth if I say that we have a very successful conference. What do you think?
Yes. Thank you.
Thank you. So we had a lot of workshops. Yes, voting. Yes, thank you. So we had a lot of workshops. We have inspired, we have educated. I think that we have a lot of information, of knowledge. So I hope that you make use of the workbook. I hope that you have taken your notes in the workbook in order to inform your national board and your national contacts, the other patients, about the knowledge that you have gained during the conference. So this is what we like and ask you to do, because we want all this information to be disseminating at national level, but also implemented. So this is our aim, and hope that through this conference, we gave it to you, this knowledge and these skills. So don't forget the evaluation form. So we're going to ask you, we're going to send you evaluation in order to evaluate. So it's very important for us to see your comments and to see what do you think? What kind of improvement do we need to make it for the next conference? So for this year, we have a live streaming, as you be informed, and you saw that during the plenaries, all the plenaries, but also during 3 workshops. So I hope that was a successful initiative. Waiting to. So this, I would like to all of you, your active participation, all the different parts of the conference, in the workshops, in the plenary, but also during the dinner and the lunch. And I saw last night that you have the very good night. Many people, they have been continue to networking after 9 and 10 o'clock in the night. So from my side, I would like to thank you. And of course, as I said before, it was one of the best conference and successful conference. So thank you, Ireland, for hosting the conference.
Thank you very much, Marios. I agree, it's been a very successful conference, but conferences don't just happen on their own. And I want you now to put your hands together to thank a lot of people who made this possible. First of all, we're really thankful for Minister Vereka for having spent time with us yesterday. And unboundless thanks go to Arthritis Ireland, to the 2 Johns and all his team. So please. We also have to thank the other pillars of EULAR in the guise of Hans Bilsma and Christina Pava, the scientific and health professionals, pillars of EULAR, who are really helpful to us in this sort of conference. So thank you very much for your participation. But we have other people also who've been absolutely indispensable. The EULAR Secretariat, Florian, Maria, Berta, and Simone. MCI, who did all the admin for us. Ruda Finn, who've done all of the work to get us here. All the speakers, the moderators, the panel, the chairs. Olga, who organized the wheelchairs for us. The technicians, Jerry and Carlo and their team. And the hotel for actually giving us the location, which has been a beautiful thing. So thank you very much to all of them. Everybody who's tweeting online with us to actually make this conference an active conference, because without your participation and your full enthusiasm, we wouldn't achieve anything. So thank you to you. Now, I've got a few admin things. Don't think you can just go off now and forget everything. Lunch is going to be in the Coast Restaurant. I think I don't know whether it's still raining, but the coastal tour, I think, was in doubt at some point. I don't know whether it's still going on. But the bus ride, train ride to Malahide Castle is still on. I think if, Peter, you put up your hand, anybody who wants to go on that and hasn't booked already, please see Peter. With 15 euros it's going to cost you, and I think the bus goes at 3:30. Okay, so don't forget to book with Peter first. Tonight, we're going to Dublin Castle, as the minister told us a lot about that fantastic place tonight. Very privileged. I think in your prayers that we're leaving after 6:30, but we're not. Please assemble at 6:15 in the lobby. The buses will be going at 6:30, so don't miss the bus, please. The dress code is informal, and there'll be 2 buses on the way back. Okay. There isn't a formal program on Sunday, but there is a networking program. So ask Mario.
Conference. So this is truth. So the task force starts immediately after this conference to work. Actually, we have already started to work for the next conference. We start to look for the venue. And I would like to inform you now for our next conference. That will be next year between 14 and 17 of April 2016. And this will be in Sofia, in Bulgaria. So just took the notes in your diaries for the next year conference, and we look forward to see you there. So I would like also to say, should I say about the transfers? So,
yes, if you like.
Yes, don't forget to confirm your transfers back to the airport. You should check your transfer in the registration desk in the lobby of the hotel.
Don't forget also to hand in your badges. EULAR would like those back, please. They're still voting for the multimedia exhibition till 3, so if you haven't voted there, please do that. And make sure you've handed in all your reimbursement forms, because once you've left, you can't have the money if you haven't filled up your form, so please do that. And finally, in preparation for our World Arthritis Day campaign, which will start at the Congress, I'd like you all to turn to your neighbor and give them a high five.
Hey.
Thank you very much.
Thank you.